Today, we are going to discuss a very important thing, that whenever you're scheduled for a surgery, how to go about it and what to keep in mind when you're going ahead with a surgical procedure. Planning goes a long way. Planning ahead of surgery ensures that your procedure is uneventful and your recovery is smooth. So every patient needs to remember that he or she has a role to play in her own recovery. And every doctor needs to remember too that an informed patient is always a much more satisfied patient. Whenever you plan for an emergency surgery, there are certain things that you need to remember. First and foremost, that time is of extreme essence. And you always have to weigh the delay in decision making against the increase of risk in complications. So whenever faced with an emergency surgery, I would advise you go to the nearby facility, which is adequately equipped and has the infrastructure to sort of handle the kind of emergency procedure that you're going to go ahead with. If you have time, you can check the credentials of the operating surgeon, what experience he has with handling similar situations in the past. The infrastructure of the place also plays an important role, that whether that place is equipped with a blood bank, an ICU, what is the availability of ventilators, and these all things also you should keep in mind when going ahead with a procedure. Now, again, I would like to emphasize that time is of extreme essence here. For example, if there's a lady in labor who has been informed that the baby is in distress, which essentially means that the baby in the womb is finding it hard to breathe or is in some kind of danger, then more than once that such a patient is going to be advised for an emergency cesarean section. And any delay in such surgery can lead to detrimental influence for the health of the baby and sometimes also the mother. So you have to take a quick decision. And, you just reach a facility which can handle such a surgery and go ahead with it. Whenever you plan for a surgery and you meet your surgeon, first and foremost, you should allay all your doubts. When many patients are hesitant to ask questions to your surgeon, but you should go ahead and ask that what would happen if you don't undergo the surgery? Are there any other medical alternatives to the surgery? These days, our medical science has advanced a lot, and there are many techniques used to perform a similar procedure. For example, whether your surgery is going to be done by an open technique, a laparoscopic technique, and also these days we are using robotic surgery. So have information about what is the advantage of one over the other. And also, talk to your surgeon that how is your recovery going to be? How long is the recovery going to take? And when are you going to be able to get back to your daily routine? If you have dependents over you, then you should know how long you can resume your daily activities. And you can also sort of, adjust your work likewise, like if you need assistance at home. Also, ask about the pain in the procedure. Certain amount of pain is normal after surgeries, and extreme amount of pain, which is not expected, can be a clue to some thing going wrong during or post-surgery. So the patient should be informed what to expect. Also, ask about the cost. Ask about how much are the total expenses going to be and whether your surgery is insured, comes under insurance or not. Once you have selected your surgeon, I would advise trust your surgeon and go ahead and be positive about the outcome of it. I personally feel it's extremely important to meet your anesthesiologist prior to surgery. Anesthesiologist is a person who is responsible for maintaining a smooth procedure. While the surgeon concentrates only on the surgical field, it's the responsibility of the anesthesiologist to see that the patient is vitally stable, has proper hemodynamics, his breathing is controlled, his pulse rate is fine, his blood pressure is fine, and he gets through the surgery. Also, it is the anesthesiologist's duty to ensure that the patient is comfortable during surgery. So, anesthesiologist plays a big role in your surgical procedure. So once you meet your anesthesiologist, they are going to ask you in detail about your medical history. What kind of comorbidities do you have? Do you suffer from any diseases before the surgery? Like, are you a diabetic? Do you have blood pressure? Do you have thyroid? And so on and so forth. And also, they might ask you about your habits, whether you drink alcohol, do you smoke, do you use any recreational drugs? And I would like to emphasize it's extremely important. So your anesthesiologist is going to ask you about your habits, whether you smoke, you drink, you use any recreational drugs. It's important to be truthful and give all your history to the anesthesiologist, because that may prevent you from leading to any complications during the surgery, as drugs during anesthesia are planned accordingly. You should lastly ask the anesthesiologist about the kind of anesthesia you're going to receive. Sometimes we have seen that patients are unaware of the type of anesthesia they're going to get. And when we decide to give them an injection in the back, they are caught by surprise. And it takes a time for them to be mentally prepared to undergo such a procedure. So it's important you know what kind of anesthesia you're going to receive, and it helps in you being more calm and comfortable on the day of procedure. When on the day of surgery, you should keep in mind that all the preoperative instructions that have been given to you, you follow them. So if you have any comorbidities or you're taking any drugs, then you would be receiving instructions to sort of continue them, stop them, alter them. So the whole idea is to get you in an optimum health, or to be in the as healthy as you can be before undergoing a surgery. So please follow the instructions that are given to you on the day of surgery also. If you're undergoing surgery under any kind of anesthesia except local anesthesia, you would be given fasting guidelines. Now, fasting doesn't only mean not having any food. It also includes not having any water. And depending on the kind of surgery and kind of anesthesia, your fasting time can vary from 4 hours to 8 hours, and you should strictly follow that. Also, try and reach the theater or your hospital on time, because surgeries are scheduled by the hospital. And whenever you plan for a surgery, rush is not a good idea either for you or for the surgeon. So try and reach the theater on time. Also, carry as little valuables as possible to the operation theater or the hospital, because before surgery, everyone is advised to remove all jewelry prior to going for surgery. Also, if you wear contact lenses, you wear hearing aids, you wear dentures, they also need to be removed prior to surgery. Carry your insurance card, carry all your identification proofs which are required so that there is no delay in paperwork when you reach the hospital. Also, you should have a responsible adult accompanying you for surgery, because sometimes during the surgery, if any complication arises, there might be some decisions that need to be taken on your behalf by your attendant, and he should be in a position to take those. Also, if you're going to be discharged on the same day, then it is important that sometimes you're advised against driving yourself. And also, you should not take any important decisions on the same day. So you need an adult to accompany you. Stay positive, like I said, and go in comfortable clothes so that when you're discharged, you might have swelling or there might be pain. So loose, comfortable clothes to on the day of discharge also will help you having a smooth, stay in the hospital and a smooth and uneventful discharge.